right, welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Janet Jokela. She's an infectious disease physician and former treasurer of the American College of Physicians. Today's Kevin MD article is How Federal Actions Threaten Vaccine Policy and Trust. Janet, welcome back to the show.
Thanks so much, Kevin. Delighted to be here.
All right, so tell us what your latest article is about.
I've been thinking a lot about trust, just the concept of trust, and thinking about what's been happening on the national level and all of that. But then thinking, all right, well, how does that translate back to what we see in the exam room? And reflecting upon that, I do think things have changed in the exam room with our patients. In the past, patients would say, Doc, what do you think I should do? What do you think? If you were in my shoes, what would you do? And I'm so glad you're here. Great to see you. All that kind of thing. And those comments imply a bond of trust between your patient and you. But then now in the exam room, I think things have changed a little bit, saying, well, I don't think I want to do that, whatever it may be. Or Google says we should do this, that, or the other thing, or more threatening kinds of comments. And I realize in the exam room, things have changed as well as things have changed on the big scale. So that's kind of where my mind has been.
And of course, you're an infectious disease physician, and that means talking about vaccines with your patients. And I think that, as we all know, the topic of vaccines is highly polarizing in the public. So when you say that patients aren't as trusting in the exam room or in the hospital where you see them, sometimes you even use the word threatening. Have you personally experienced or seen some of this mistrust? And what exactly does that look like?
Yeah, I think it varies, from patient to patient. Some years ago, yes, I experienced that kind of mistrust and anger, and that was over an opioid prescription, and that was quite unsettling to the point where from the point of view of the hospital, I sought extra protection from the hospital's security people, you know, for myself
Hmm.
and the staff. But that aside, otherwise, it's also just been more lengthy conversations like, well, should I really get this vaccine? Do I really need it? Why? And all that, all those kinds of discussions. So, yeah, there's been, and a lot of that as well.
And why do you think over the past few years that mistrust, why has that grown bigger?
Yeah, certainly in primary care, I think there's a few aspects to that are important. One is the systematic, if you want to call it minimization of primary care relative to other specialties, perhaps. And then also our time pressures, they're being squeezed. And I think to really develop trust, you need time to develop that relationship and time
Hmm.
to really connect with the patient and listen to them. And when our time is squeezed, some of those things are on the surface anyway, the easiest things to kind of move on from, and that really hinders us. The second major thing, I think, of course, is the pandemic. I can't help but think that in many ways, all of us, patients, physicians, everybody, we're all still reeling from the effects of that. And I think that's in large part maybe where we are.
So when we talk about trust, of course, the actions by the federal government sometimes may play a role into that. In your article, you talk about the recent removal of the members of the ACIP, the Advisory Committee on Immunization Practices. So tell us more about what you wrote about that in your article.
Yeah, Kevin, when that all came down, which was back in June, I believe, is when that happened, it was so sad. It was just so sad. ACIP, in many ways, has flown under the radar for probably as long as it's been in existence. I mean, the all of us in medicine, in public health, and the public have known that the members of that committee have been thoroughly vetted, very carefully vetted in a very transparent process. And the work that they do was of the highest caliber and highest quality. These are national vaccine and vaccination experts from all over the country, and you could really place your trust in them. For a federal government official to go in and just unilaterally dismiss the committee and then replace them with individuals who have not been vetted. We don't know what all the conflicts of interest are. We've heard a bit about what some of their positions are on vaccine and vaccinations. It's just, it's kind of like a federal level gut punch, if you
Mm.
will. And it's like, how did we get here and how did that ever happen? So.
So, for those who aren't familiar with what the ACIP members do, what exactly are their roles?
Yeah. It's a good question, and it's a really important committee. And again, I think in retrospect, probably many of us have just taken it for granted because it's worked so well for decades, for a long, long time. But in essence, they make the vaccine recommendations to the CDC for how kids should be immunized, how adults should be immunized, and all of that. So they look at things like which vaccines are important, which vaccines should be given when, what are the ramifications if a vaccine is given at, this time as opposed to that time, what's the safety of the vaccines, on, and all the various permutations of that. And you can imagine why it would be so critical to have vaccine and vaccination experts in that place and in that room making those decisions. So that's a lot of the work that they do. And then taking it a step further, these recommendations guide US policy on insurance practices. So will insurance programs, Medicaid and all of that, will they cover vaccinations? So it's a really important committee for the whole country and everybody's vaccinations.
So, of course, a large portion of the electorate would read these news and then they would read the explanations by our federal officials as to why they remove these members. So, what kind of reasons are the public getting in terms of why these ACIP members were removed?
Kevin, it saddens me to say this, okay? But the rationale that was given for the firing of all these ACIP members is that we wanted to restore trust in this committee and in the process. And I mean, it's just a very, and this is my opinion, that it's a very legalese twisting of the concept of trust. And it's exactly backwards.
Hmm.
It's exactly backwards. But maybe that's what some people do who are trying to, promote a certain position or other points of view in certain, in certain places. So it was tragic. It was just tragic.
And who do they replace these members with? You earlier said that they weren't vetted and sometimes they may have viewpoints outside of the medical mainstream. So tell us just in general, who did they replace these members with, these people who will be determining and make recommendations about vaccine policy going forward?
Sure. And that's important. One of the articles that I referenced in the piece that I wrote does go into that in more detail. So the article that was published in the Annals of Internal Medicine, authored by Jason Goldman, our president, and then also Robert Hopkins, who's been a long internal medicine doc who's been in the vaccine space for a long, long time, also a national expert on vaccines and vaccinations. What they mentioned, as I recall, there's a handful of people. It's not, they replaced, the committee was replaced with 8 people, one of whom withdrew early on, so there were only 7 there total. The lead person, the chair of the committee now, was one of the authors of the Great Barrington Declaration, which was quite a controversial statement early on during the pandemic, just talking about the importance of herd immunity and
Hmm.
all of that, but non-physician. And then there's someone else, as I recall, who has been very visibly involved in some anti-vaccine initiatives and activities, and kind of very publicly known to be kind of a, for lack of a better phrase, like an anti-vax kind of
Hmm.
position. So off the top of my head, that's who I recall. The article that I referenced goes into it in a little bit more detail.
So, if we have members with contrasting views on the committee, tell us about some of the ramifications that you can imagine going forward.
Well, and I think we've been seeing some of that already. So even how the ACIP spent its time when it did meet, they debated the topic of thimerosal, and this was an issue that had been put to rest, kind of put to bed, a number of years ago. That in terms of the risk of thimerosal causing any serious consequences in kids is just it's not an issue. It's a non-issue in the way that the vaccines are manufactured today. So anyway, to bring that up again and to go through data which as I understood it, was questionable to begin with, and to spend time on an issue like that, as opposed to time on more meaningful and kind of pressing concerns and issues, it's an example of a really unfortunate opportunity cost to be spending time on issues which are not issues, not critical issues, versus time on things and energy on other issues which are important and do need to be considered and thought about. So that's just one example.
So I've read some perspectives saying that sometimes if we suppress voices that are outside of the mainstream, that can only sow more distrust. And that was one of the reasons why we lost that trust in public health, especially during the pandemic. So even if they promote views that are outside the mainstream and that have zero scientific credibility, what's the best way to handle those alternative viewpoints, right? Because it's a substantial amount of the electorate who believes them, right? And then sometimes if we suppress them and not allow them to speak, that can only sow more distrust. So it's a little bit of a paradox here, right? So what are some ideas you have going forward in this environment that we're in?
Kevin, that's exactly where my head has been. Like, how do we do this and how do we navigate this? And on the larger levels, federal level, public level, and all that, I think it's exceedingly difficult. That there are some really wonderful communicators who do address this in a very respectful, empathetic way. And I think the challenge on that level is just because there may be a loud voice about this point or that point or the other point, it doesn't mean it's a majority voice, or that, even, 20% of people agree. That may not be the case at all. The data that we do have shows that the vast majority of people in this country support vaccines and vaccinations and know how important they are. So the question is, how do we best support good scientific approaches to what we do and to medicine and public health, and how do we do it in a respectful way that at the same time doesn't give, yeah, like, I'm just thinking, how do we say this? You're right. How do we approach this? You don't want to give more weight or more credence to these other positions which are not grounded in what we know is correct. At the same time, you want to be respectful to those folks, but not not give them a major platform, or not present information as being equivalent, like it could be this or it could be that.
Hmm.
No, that's not right. So it's a very nuanced conversation, I think, that many people are giving a tremendous amount of thought to, and to figure out how we do navigate this. It's really not easy.
So what's the response of our professional societies like the ACP? How are they responding to some of these changes?
Yeah, yeah. That's really important. The professional societies have become increasingly vocal, I think, about these things, certainly with the ACIP issue and all of this. ACP has been right there. They've been issuing statements, publishing editorials, and then, really remarkably, they were one of a handful of organizations that entered as plaintiffs in a lawsuit, essentially saying, look at this is just wrong. It's endangering patients. And this had to do with the new COVID-19 vaccine recommendations for pregnancy or in pregnancy, and also for healthy children. So they've been right there. And there's a lot of really good information, I think, published on the ECP website and elsewhere that really addresses this. IDSA has been active too, the pediatricians as well. So there's been a number of professional societies that have become increasingly vocal.
So we're seeing changes, of course, not only with the ACIP, but the U.S. Preventative Services Task Force as well. And then sometimes they're being replaced with members with views that may be outside of the medical mainstream.
Yeah.
The problem is they're giving recommendations to federal agencies, right? Like the CDC, and the public is going to view these recommendations that may be suspect, right?
Yeah.
So, how do you reconcile that going forward? Do you see that we need competing recommendations with members that are more scientifically accurate? So how do we sort this out going forward?
I think it's going to be really difficult for our patients for that reason. We've gotten so used to over the many, many years of relying upon guidance and recommendations from the federal government on these things. And now there are individuals in place in the federal government who possess alternative viewpoints. And when that guidance and advice goes out to the public, it's no surprise that the public would be confused, and it just makes it a lot more difficult for us when we're in the exam room with patients to try to mitigate that and try to combat that a little bit. I think that's the challenge when there are individuals in positions of authority in the federal government and saying whatever it is they may be saying, and it's like we know that's incorrect, and we have to remain steady and kind of in some ways push back against that in a way that we know is correct. So the ACP is doing that. There's this interesting project out of the University of Minnesota, the Vaccine Integrity Project,
Hmm.
which is, in a way is another group that, it's nascent, it's still new, but that may evolve into something like what you were just mentioning, an alternative. Ironically, right? I mean, how could that be alternative? That should be primary. But anyway, the evidence-based and scientifically sound guidance on these different issues where the government is going in a different direction.
We're talking to Janet Jokela, infectious disease physician and former treasurer of the American College of Physicians. Today's Kevin MD article is How Federal Actions Threaten Vaccine Policy and Trust. Janet, as always, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Sure. Thank you, Kevin. I think three things come to mind. One is remain engaged with our professional societies like the ACP. The ACP is in a great place, doing good work and sound work. It's inspiring to me and certainly to many others. Second, excuse me, I think it's important to keep our eyes on the horizon in terms of how things are evolving nationally and what's going on. And then third, the last one, I really like Paul Farmer's advice, and he's the one who helped found Partners in Health and did some wonderful work there. And his comment about trust was trust is built one patient at a time. And for
Mm.
those of us in exam rooms and in that space, that's all we can do. And with that approach, he built this amazing entity that continues to do good work today.
Jen, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you so much.